A 25-year-old athlete collapses during a football match and is brought to the emergency room. He is diagnosed with hypertrophic obstructive cardiomyopathy. What is the most likely cause of death in such patients? A pulmonary embolism. B. Sudden cardiac arrhythmia. C. Aortic rupture. D. Heart block.
Now let's look at the clinical features. So the most of the patients are usually asymptomatic at the presentation. But if they are symptomatic, they'll have, you can remember these symptoms as S, A, and D. S for syncope or presyncope or lightheadedness, we know the reason, and A for angina, and D for dyspnea because of pulmonary congestion or edema. And there can be a sudden cardiac death. This is the most dreadful complication that we are worried about when the patient is diagnosed with hypertrophic cardiomyopathy. The reason is the ventricular hypertrophy and the microinfarcts that keep happening because of the microvascular ischemia. There can be development of fibrosis, and the fibrosis can be a substrate for the development of ventricular tachycardia or ventricular fibrillation. So the most common cause of death here in a patient of HCM is ventricular tachycardia or ventricular fibrillation. There is also a history of sudden cardiac death in the family because most of the cases are genetic. And on examination, when you look at the vital examination, when the patient does some physical activity, the blood pressure will decrease or it may not increase.